we've got quite a tight-knit strength and conditioning team here, and we've got the benefit of working alongside our doctors and our physiotherapists as well. So we work quite closely with those guys in our programming to work on maybe the biggest areas of injury that they'd be likely to see in order to prevent those. And then we've obviously got the performance aspect.
We look at it as a holistic type approach, so we don't just treat the injury, we treat the whole movement pattern, and the same thing with the sport. You know, we try and get that athlete strong and fit for their sport, and we don't look specifically at one area. We really look at the whole picture, so all the conditioning, all the strength and power aspects of it, and all the injury prevention as well. And I think probably the injury prevention stuff here is probably one of our specialties.
A lot of people, you know, look for the quick fix, you know, the injection, whatever sort of medical intervention is that can treat the symptoms of the injury, but not necessarily addressing the cause. So we really try and strip it down, get to the root cause of it. We can break it down to a very, you know, fraction of a second, what they're doing wrong and how they're correcting it, and be able to measure the progress.
We'll be very focused on trying to educate the athletes as they go along. So in our young athlete development programs, by the end of the weeks or the months of training, we'd expect them to be able to almost coach themselves. So they know what they're looking for from the different techniques, how they're going to change direction, jumping and landing mechanics as well.
There's no place like it in Ireland, probably very few like it in the world, where you've got so much experience in different areas.
Those skills, along with the facility and being able to actually have a nice facility to take athletes through the programs, is probably what sets us apart.
A new service that was added this year is called the Run Elite service. So we look at more elite athletes, regardless whether runners, triathletes, cyclists, you know, or field sport players who want to improve their performance, both the physical performance and their, I suppose, conditioning or physiological performance. So we can measure an athlete's lactate threshold and then help them design a training program to help them improve their lactate threshold, which would result in an improvement in performance. And we also help them with other areas of recovery, how they balance their training program out, how they maybe manage other stresses like family or work, or even help them prepare for competitions.
Once coming through the rehabilitation stage, they're better now essentially. They want to keep coming back here to train, and it's great to work with those kind of athletes and patients as well, because you see a real change in people's lives.